I didn't really know the side effects when I started, that they could happen. The doctor just says, they give you kind of like this book and says, all the things that could happen to you during chemo.
Yeah.
You start reading them, and then you're like, I don't want to read this anymore. Hey, what's up? Welcome to Heal, Laugh, and Rise Up. I'm Yezi, your badass two-time cancer fighter, soul work mentor, and your favorite Latina.
Hi, and I'm Amber, a chemo nurse by day, caretaker to my husband by night, all while being a scrunchy mom.
We're here to talk all about our traumas and how we use them to grow, honey.
So grab your drink and let's get into today's miracle and shit show. A lot of people are reaching out to you through your cancer journey.
Right.
You didn't want to be the cancer girl.
Yes.
I don't want you to be the cancer girl.
Right.
But I'm so proud of you for taking what you have and making it so beautiful and supporting others.
Yeah.
And I'm so glad that we're able to do this through this podcast.
Yes. And it actually feels weird. I think I said it in the episode when we did talk about my journey, that it's been one of the most beautiful experiences of my life. And when I thought back and I heard myself say that, and then I thought about the people that have gone through the journey that didn't have the same experiences I did.
Yeah.
Very traumatic, very stressful, very depressing, crying every day. I mean, I know some friends personally that have gone through the journey, and I feel a little guilty about that. Why do I feel
almost like
guilty?
A survivor's guilt, but both of you are living, but one of you is thriving post. You've like healed,
or during also though. For me, I believe I was thriving during, compared to other stories that I've heard.
Absolutely.
But that doesn't make one better than the other.
No.
Maybe my story could possibly give somebody a little hope that I can still go to the concert while I'm getting treatment and try to live a normal life and try to stay in a peaceful state of mind. But
the nurse in me, I'm like, if your white blood cell is high enough.
Right.
I'm
exactly.
Like,
yes, that's why I'm saying.
I got nervous when you say this.
I know. Exactly.
Yeah.
Because everybody's perspective is different. But me going through this journey, even though a lot of the stuff that I still haven't spoken on, like on some of the side effects and some of the long-term things that could happen to you.
Yeah.
Like that people don't know because they see you and they're like, oh, she's good. Her hair's growing back. And some of the side effects I don't talk about because I accept them. And I know it's part of
So what side effects do you have?
So right now, one of the side effects that I continue to have is my tongue. Chemo, the first time around in 2020, didn't do anything to my tongue, which what I mean by that is the tongue feels like if you have 1,000,000 cuts.
Stick your tongue out. Okay, your tongue looks normal.
Right. So that's what's kind of like, to me, it's like, if it looks normal now after.
It must be fine.
So now I think, oh my God, do I have cancer in my tongue? Why is it still not healed? I can't have anything spicy. Pizza is spicy. Marinara sauce is spicy. Anything with too much salt hurts.
You sound like a white person.
I have morphed into you kids that I went to school with. We are one. Yeah, and it sucks because I'm a Latina. I like chips and salsa. I love everything spicy.
Yeah.
So that is one of them.
Or even just acidic.
Acidic.
Yeah.
So that's why anything that's creamy, it feels good. While you're going through the chemo, you can't taste anything. Everything tastes like cardboard. Water is horrible. Then you stop chemo.
Even like metallic-y taste.
Oh, yes. And it's been 7 months, I believe. Why do I still have this side effect?
Well, you're still on treatment.
I'm still on treatment. It's
different treatment,
right?
So you feel like it should go away, huh?
This is what I'm thinking. Why am I not back to normal? It's been 7 months. A lot of bone pain. A lot of bone pain from the medication that I'm taking on the daily, twice a day. I have trouble. It's funny because Alex is so cute. We'll be sleeping. Here's an example. We'll be sleeping, and I like to turn from right to left. And, every time I turn, it's a grunt because it hurts. So I'll turn and I'm like, ow, 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 ow. And I was like, hey, what's the matter? What's the matter? I'm like, no, it's just my bones. And getting out of bed, I got to do the kick to get out of bed. I can't push my shoulders. My shoulders are way too In the morning especially, it's more. And I drive. I can't change. Sometimes I can't change lanes to the right because it hurts more to turn my head. Chemo brain. You keep saying chemo brain, right?
Chemo brain.
Which is a form of...
Like mental fog and memory loss.
Memory loss is a part of the side effects. Sometimes it gets better, sometimes it doesn't. I had chemo in 2020, 4 rounds. I believe I had 8 or 9 rounds. I lost track this past year. Now, when you go do it back to back, there's going to be damage to your brain cells.
Yeah.
So I don't remember a lot of things, and that's one of the things that I struggle a lot with right now is my memory loss. Especially Alex would tell me a story, and then I said, I don't remember. And then he gets his feelings hurt, and I feel bad. And then the more that I read...
A story of something you were there.
Yeah.
You should remember.
I'll be like, oh, have we ever gone to this restaurant? We should go. And he looks at me like, we were there. Yeah. And I'm like, I don't remember. And it hurts his feelings. And it hurts my feelings because I don't want to have this memory loss.
Oh, of course.
And then,
it's frustrating.
Or sometimes people will ask me something. I'm like, oh, yeah. And I have no idea what they're talking about. So I have to cover it. But then I feel like we need to educate people. Yeah. It's a real thing. Chemo brain is a real thing. And knowing that you survived, but your body took a big ass hit. And not remembering, I think right now is one of my biggest challenges. And accepting and being part of like you said, a support group.
It's going to make it a lot easier.
And I read when these other people say like, oh my God, chemo brain, I don't remember. And then you read everybody's talking about the same thing. And
How does that make you feel?
Like this, like I can breathe, like I'm okay. It's wonderful to be part of a support group. Get online, find a support group. Even if, like you said, even if you're just reading.
Yeah, even if you're
I'm just reading these comments and I'm like, okay, I'm not the
You're not ready to open up, that's fine.
Another thing that I said in my podcast was when I said that I always knew I was going to get cancer. Mm-hmm. I had a feedback from a great friend who her mother lost the battle, and she says, I always just think it's going to be me. And she said, hearing me say that made it feel better. Mm-hmm. Me hearing her say that, I didn't feel alone because I'm like, okay, that wasn't like a crazy thought. Yeah. You know, I was trying to realize why I was so bothered when people would tell me, you're so skinny. I lost 30 pounds this last journey. That's a lot of weight. Yeah. From 160 to 135, 133, and I'm 5'8". That's skinny. And
you lost all this weight. So you lost all this weight with your cancer journey.
With the chemo, yeah. Not
it was one of... I got you. Cancer didn't make you lose weight.
No, at least this is what my perspective. You're a nurse. You can probably tell me if that's true. The cancer is not what's making you skinny. It's a venom that they're putting in your veins that makes you, and not that itself, but the side effects that you can't eat and not.
Okay, so the side effects of chemo made you lose 30 pounds.
Yes.
The first time?
No, the first time I lost. I don't remember how much, but it wasn't as much as this one because I.
And then did you gain it back the first time?
The first time, yes.
And then now you've lost 30
I've lost 60 pounds. I'm sorry. No, Dios mío, no, 30 pounds. Wait, how much did I lose? Did 30. I say 30? And I'm up 15.
Okay.
But I was a little overweight, so if I can just gain 20 back, I'm good.
Okay, so you want 5 more?
5 more.
Okay.
Don't you see these little hips coming back, girl?
I see your hips.
You see my butt?
That booty.
But one day I was like, why does it bother me so much when people tell me that I'm skinny? That number one thing, if you know somebody who's going through treatment, please don't tell them that they look skinny. They know they look skinny. It is a trigger for me. And one day I was reflecting and I was meditating and I was praying and really working on myself. And I thought, oh, I know why it triggers me, because I was made fun of all my life that I was skinny. Now when people say, oh, you look skinny, I hate it. Mm-hmm. But that's why I say, reflecting back. Why do we do certain things? Why are certain things triggers? You have to sit with the little you and say, okay, I'm skinny because I'm going through the journey. I'm killing my cancer, but this is also killing a lot of things that are healthy in my body. And this is a result of it.
Yeah. And that's exactly what chemo does. Yeah.
That's what it is. So as a nurse, this is your job to give the information. Yeah. And knowing, especially if you have friends and family that are going through the journey, how does that make you feel, like to tell someone, you have stage 4 or what?
Well, I don't do that. The doctor does.
Oh, I'm saying when you're working with them.
Oh, I'm like, well,
I meant to say.
No, but they do. Majority of
and
people.
And they ask you, right?
They come in and they were, they're in a fog when they get their diagnosis. So they do come in and, hey, I didn't ask the doctor what stage I am. Yeah. But my brother wants to know. Right. Or what do I have again? Yes. What am I taking? Yes. Yeah. That does happen. And I'm always like, oh, I have to make sure the doctor told you before I tell you. Right. I'm not allowed to.
I'm not allowed to tell you.
But I do, and I have to go read the note. Or most of the times when they're confused, if it's not just a simple, hey, I wanted to write it down this time, I will just put them on the schedule to see the doctor.
Okay.
Go talk to your doctor again.
Yeah.
I don't mean to pass the buck, but that's not my place.
And can I tell you something? As a patient, if my nurse that was giving me...
You think it's bad news.
Yes.
I know.
Yes,
I tell them.
girl. Oh,
and
my
I even
God.
say
when
that.
they're like, oh, you need to talk to your doctor. I'm like, wait. Am I dying? Wait.
And I do the same thing. But I will say, oh, I'm sorry. Like, it's not really my place. I can tell you it says here that if I can see that they've talked to the doctor already, I'll say, oh, it says here in your chart that you are stage 4. This is the type of cancer you have. Do you have other questions about it? Because I can put you on the schedule with the doctor.
Okay.
And that's what I mean by if it's a simple, because I'll say that, they'll write it down, or they'll go, oh, okay, and they move on. But if it's questions, oh, well, what are my statistics? Am I going to die?
Yes.
And I go, that stuff, I don't know. All I know is chemo. They come in, how are my labs? Good enough for chemo. Yeah. That's my answer.
Yeah.
I don't know.
Yeah, right.
That's not my job.
You're not a doctor, right.
We have a range we follow.
Okay.
You're within this range, I'm allowed to give you chemo.
Right.
I'll be honest, my range is much lower than a healthier person. What is something that, when you were diagnosed, you wish someone gave you a heads up about? Gosh, I wish I knew this could have happened.
I didn't really know the side effects when I started, that they could happen. The doctor just says, they give you kind of like this book and says, all the things that could happen to you during chemo.
Yeah.
You start reading them, and then you're like, I don't want to read this anymore.
Yeah, you don't read
So I didn't know I didn't really know anything other than my prima who came. I talked about this. She came and sat down, and she says, you can probably, if the medication is not regulated right and some of your levels are off and you don't know, some of your side effects could be very...
They can get worse.
Bad, like hallucinating and seeing things. And when she told me this, I really thought, I'm going to get chemo and then I'm going to see like something horrible in the corner, But she was giving me the extreme of what could happen.
Yeah, I think something that, because it is an extreme, it's not talked about.
Right.
Yeah. But what's interesting is, I've seen nurses, or I've heard patients come from other places, or this is their second time around, tell me, did you know that this could happen? No one ever told me. So when it happened, I thought, oh, well, it's part of my journey. Oh, wait, I'm getting chemo. It's going to happen to everyone. And they don't say anything. So now I don't know what your prima told you. But what it made me think of is, and you said this earlier, when you get chemo, it's this poison that we're putting in your body.
Okay.
And it's breaking down everything. Unless it's a targeted treatment.
Like I'm getting now?
Like you're getting now, which has its stuff like this. But I just mean like basic general chemotherapy. It goes in and it's killing everything. It's killing the cancer. It's killing you. It's killing your white blood cells. It's killing your red blood cells. It's maybe causing a toxicity in your liver. There's all these things we're watching.
Right.
It goes in and it kills your cells.
Right.
Okay. It's killing your cancer cells. This is why it's so important to drink so much water.
Right.
Because you have these broken pieces of cancer cells floating around in your body. And for you to get it out, we expel it all through urine and feces. You have to pee it out.
Right.
You have to poop it out. That's how we get rid of it. These broken, dead pieces. Now, sometimes what happens is you're dehydrated. You can't drink water.
You can't drink water. You cannot drink
it. Shit. You're so dehydrated. And these things, they're floating around in your body. They're building up. You're getting high levels. And now it's in your brain. You don't have cancer in your brain, but you have these levels that are just fucking up your hormones, fucking up the way you're thinking. Maybe you have a toxicity of a certain poison that you got, and now you are hallucinating.
Right.
This is not normal.
Right. Yes, it is not normal.
this is not okay. You
No.
need to tell somebody.
Yes, and that's the
so they can change your regimen.
How do you know if somebody doesn't tell you? That's what my
Exactly.
cousin said. If this starts happening, you need to be an advocate.
Say something.
Look at but
Yeah.
if you don't know, you just think it's part of the treatment.
Yeah, and I hear a lot of people come and they're like, "Oh, I was just given this book." No, that nurse should have given you some basics.
They don't,
Which
though.
I think is why I'm so adamant about it in my teaching. I do give you a few pages and I highlight the really important things.
Okay.
And then I go over things.
Okay.
And my last line in my teaching and my last line before the person walks out, even if it's their 18th time there, please call us if you're experiencing anything that's not normal to you. Even if it's on that paper.
Right.
Even if it's an extreme, even if it's a norm, I don't care. Let us know.
Right.
I want to be able to open your chart and see that it made, the second time you got chemo was the first time you threw up. I want to know that.
Yeah.
Throwing up is normal.
Right.
I expect you to throw up.
Right.
If you don't, I'm so happy for you. But I expect you to.
Right.
It doesn't mean I don't want to know. Let us know what's happening because some of it's not supposed to be happening.
Right.
Your tongue, it's expected. With the treatment you were on, if your tongue got worse, maybe we would have changed things.
Right.
Maybe there would have been a dose reduction. Maybe we would have kept it exactly the way it is. It's very specific to you, what you're going through, what you're on.
Yeah, but speak up and say.
But you have to let us know.
Yeah.
Don't come in with gloves on because it's cold outside and then not tell me about your hand sores.
Yes.
Or the neuropathy in your nails and the black lines on your nails.
Can you tell us what neuropathy is?
A pain, maybe some people don't describe it as pain. It's more like a burning, it's described as a burning sensation in your fingers and your toes. It can come up your hands and into your feet.
Right.
Very common side effect of a lot of chemos.
Yes, I didn't get that. Praise God. I did not get, because you would ask me. I think you would ask me, like,
yeah, I would. Because
do you feel, does it feel numb a little bit?
Well, it's very specific.
But my nails turn purple. Remember I told you, I said, I think I have fungus.
And
I thought I had fungus in my nails. I'm like, why are my nails purple?
Yeah.
And then you had asked me what the sensation. I didn't have a sensation. My nails turned purple.
So the darkening of the nails?
Yeah.
Not a huge concern.
Okay.
Usually neuropathy or the nail coloring come hand in hand. When your neuropathy happens, it's sometimes not reversible. So that's why when you showed me your nail color, I wasn't concerned.
But you asked me.
But I asked you about neuropathy. Because if that's happening, your doctor needs to know so they can either dose reduce or change the regimen.
Okay.
Because if not, some people, because of your type of cancer, we have to weigh the pros and cons.
Right.
Are you going to have some neuropathy for the rest of your life? And we're going to give you a pill that gets rid of it.
Okay. That you take for the rest of your life?
Yeah, to get rid of that pain.
Okay.
But we killed your cancer.
Right.
Or how's your cancer? Are we able to dose reduce and still be effective? Because they won't dose reduce if it's not effective.
Right. They're not going to turn down the dial.
If it's not.
Right.
If it is still effective, we will.
Okay.
But it's just weighing that pros and cons.
Right.
And let the doctor decide. Let them, don't say, oh, I can handle the mouth sores.
Yes.
I can handle the sores all over my hands, mouth, and feet that look like they're just burns.
They're burns.
I just put aloe vera on it, whatever, move on with my life. No, let the doctor know.
Right. You're right.
This is something we don't want to turn into something worse, especially when it comes to sores. Yeah. Anything open sores in your mouth, on your lips, on your hands. Maybe you're bruising more easily. Let your doctor know.
Yeah.
But when it comes to open sores, you don't want to be having prone to infection.
Yeah, that's what I was going to say. You don't want to get an infection while you're getting chemo.
No. And you might think, I can handle it. It's not that big of a deal. It's a little bit of pain.
Yeah.
I want to get rid of my cancer.
Yeah.
Well, you get one more treatment and that little bit of pain turns into an infection. Well, guess what? Now you cannot get treatment.
Right.
When before we probably could have treated you, dose reduced, or maybe just waited 1 week, 2 weeks.
Yeah, take a week off.
Chemo.
Right.
But when you're pushing through and we don't know it, and it turns into something worse, you might jeopardize your treatment.
Right.
So definitely being open. I know it's not comfortable to talk to your doctor. It's way more comfortable to talk to the nurse.
Yes, or suck it up. Like La Comunidad Latina is like we don't say nothing. We just suck it up. And also one of the things about chemo was when I would get my treatment and they say, when you flush the toilet,
Flush twice.
Flush twice. And people would say, why do you have to flush twice? Like, why? And especially if you're using the common restroom.
The same toilet.
They say if you are using the same, you only have one, you share it, you got to flush it twice.
Put the lid down and flush twice.
And I would spray it. I would actually clean it with alcohol, with bleach. Because it is a venom. You don't want anybody to be around it. Even kissing, that was another thing.
No sex? Put on a condom.
No sex.
If you're really feeling up to it, go for it.
Yeah, go for it. But these are all these things that people don't realize, that when you're getting chemo, you're getting venom in your vein for 5 hours. My treatments were 5 hours long. And as I was getting treatment, I would try really hard to drink a bunch of water.
Yes.
Because I learned that through someone who went through the journey. You want to just flush that shit out as fast as possible. And then when it comes out, girl, can I tell you this? It hurts and it burns.
Yeah.
It feels like venom. Mm-hmm. It burns.
And the more water you drink, the less it should burn. But if you're not drinking anything, I don't like to say, it's going to burn, because some people still don't feel that.
Right. Yeah.
And it doesn't mean it's not working.
Mm-hmm.
But for the people who are feeling it, like, drink more water. It may not fix the problem, but it might make it easier.
Yeah.
But you should everyone drink more water.
Yeah, everybody should drink water.
If your chemo is, I don't know if you know this because you didn't have this. If your chemo is red or purple.
Yeah, the red devil.
Or yellow. Yeah. Your urine is going to be that. Your tears could be this color.
Yes.
Your sweat. It goes in, it comes out. Yours was clear, so you didn't see that it's coming out. It's still coming out.
It's coming out.
I remember when you went through your cancer journey the second time, and I had talked to you and Alex about, you're going through this right after treatment. I'm sorry, but you are not allowed to sweat, lick, kiss my baby.
Nothing.
Because it was really important.
Yeah. What could happen? What would happen?
You're gonna get chemo on her.
Yeah.
Which I don't want her having chemo. She doesn't need it. Yeah. If you don't need chemo, do not get chemo.
Isn't it interesting that they're like, we're giving you this venom, but do not kiss your husband, do not sweat. He cannot get one drop of this chemo on him. You got to flush the toilet twice, wipe everything down.
Ooh, I love it. My patients are sitting. I work in this small little office. Mm-hmm. I come walking out with my big gown on. Sometimes I still have my goggles and my my other mask, because I'm also the farm tech there, and I mix the meds. So I've made your chemo. I come out all freaking covered up, and I'm like, okay, here you go. Like, I'm going to go put this in your body, but I am extremely covered.
It almost looks like you're going to like those nuclear plants where
or like when COVID first came out, or the Ebola, like how they're all dressed. Yeah.
Do you know that I didn't know that until we partnered up? I thought that they just get it from the pharmacy down right there on the Kaiser.
I think Kaiser does.
Oh, do they?
Yeah.
Okay. But I didn't know that you are mixing these chemicals together to create.
You didn't know the pharmacy was?
I didn't know that. I thought it just came this way.
Oh.
So you told me, well, I have to wear gloves. I have to do this. I have to do that. I'm like, wait, what?
Well, I know, but I don't think most nurses, I'll tell you now, most nurses don't.
That's what I'm saying.
Yeah.
I didn't know behind the scenes, this is how
chemo is about.
Yes.
Is made.
Chemo. It is.
Think about like a Tylenol. Who do you think's manufacturing this little?
I guess I never realized. I never even thought. Gave it a thought. It's so dangerous that you have to have all this gear, but then you come and poke my IV and then give it to me.
Like, I want it in your bloodstream.
In your bloodstream.
I want it to go through your body, through your heart, into your lungs.
Imagine. Wow.
That's what's happening.
Your heart.
Your blood goes through your heart, girl.
Mm-hmm. I didn't think about that one. Your heart.
I know. It's kind of creepy, right?
And that's why they check all these that's why they do labs every 3 weeks. We want to make sure that it is killing the cancer. It's also killing a lot of the stuff, but we want to make sure that it's not killing the healthy stuff enough to where we need to put you in the ER. Shout
out to all my patients who get their labs done 2 to 3 days before chemo, like I asked them to.
Okay.
Because I'm aware that you are just barely, if even, starting to feel better.
Yes.
We knocked you on your ass last time we gave you treatment, and you are just starting to feel better. And this is your one day that maybe you're going to go eat outside with your sisters coming over.
And you have the strength to go to the market or whatever.
But instead, you have to go and get your labs done. And you choose to let your sister come over, and you guys have lunch, and she takes you to get your labs done, and it's a pain in the ass, but you did it.
Right.
Because there's a lot of people who go, oh, well, it was my only day, and, I don't have a lot of life going on. So, and I appreciate, I guess I do. I appreciate and I understand where your mindset is in not getting your labs done because it was the one time you could do something. You need to get your labs done. I cannot treat you.
Yeah.
So don't come in and say, well, this is what happened. I know, and I'm really sorry that you're living through this, but now I cannot treat you. Don't yell at me.
Yeah.
I cannot treat you.
Yeah, right.
It's really important to know that your body can handle it before I knock you down again.
Right.
Maybe you have to be 1 more week. Or maybe we're going to keep treating you, but now I can add an injection that's going to bring your white blood cells up.
Yeah.
Which, the downside of
that injection.
So you already have body pain, achy pain. Now we're going to give you an injection for 3 days, for 5 days, maybe only once. And you're going to have major, major pain.
Yeah.
If that's you, or you're new to this and your doctor says, hey, I think we're going to prescribe these if you need it, immediately say back, I heard Claritin takes away body pain. Can I take a Claritin at that same time?
Right.
Because most likely you can, and it's going to make it a little easier.
Right.
But the doctors don't automatically prescribe it.
No.
So ask for Claritin.
Well, you've helped me a lot in this journey because I remember I only got one call this past journey from the ER doctor who saw my labs. Remember that? Remember that?
Yeah, I do.
And he called me. It was like 10 o'clock at night, 9:30, and I was getting a call from Kaiser. I said, shit, what's happening? He said, I just got your labs, and, your blood count is very low. I like, how do you feel? And I started, then when he told me that, I'm like, oh my God, I don't feel good because the call made me,
yeah.
You know, when you get so scared, you're like, oh my God, I don't think I can breathe.
And in reality, your numbers have always been this low.
Right. And he said, I said, I see my doctor tomorrow. And then we talked about it, and I had talked to you, and they said, well, they can probably give you a shot to bring it up, but it's going to be very painful.
Yeah, most likely. And some doctors will say, no, you don't need the shots. We want to just wait 1 week.
That's what my doctor did. She said, we're just going to get your body to get back up.
That's not a bad thing. You can ask, you can bring it to your doctor's attention. Okay, well, I don't mind going through all the pain. Give me the shot so I can move forward. But ask your doctor, is that necessary? What does your doctor recommend? They're the ones that see everything going on. They can educate you, and you can be open with, I had a patient, my doctor preferred the patient get the shots.
Okay.
The patient said, is there any other option? Because I'm very open to waiting 1 week. And we did. You have your rights. When I say let the doctor decide, I don't mean you don't have rights. But make sure the doctor knows what you're going through. Make sure the doctor knows that you don't want to be in more pain, you can't handle it. That you're willing to wait 1 more week.
Right.
Let the doctor then explain to you what that means and what the risks are. And then make a decision. Or be super honest and say, hey, I'm really foggy in my head and I don't even know what the right answer is. The doctor has done this. Let them decide if you don't know.
Yeah, they know.
And it's a lot you guys are going through.
It is a lot. It's a lot too. Like you said, you're first of all, you're in shock. So you're trying to process things, and then you get all this information, and it just, just the more we talk about it, being plugged in, I feel very grateful that I can share a little part of my story, and that I'm getting feedback from people who maybe feel alone in this journey, because it is a very lonely journey, because nobody else has experienced those things. And maybe like me, like my past relationship with cancer, those people are not here, didn't go through treatment, so I can't learn from them. So hopefully you can learn a little something. We're giving a big hug to anybody going through the journey, newly diagnosed, survivors, everybody out there, people who have family members that are going through the journey. Reach out if you have any questions. We have 2 experienced people here, one on one end and one on the other. Why don't you guys like, follow, share, just hit that subscribe button.
Yeah, thank you. We'll see you next week.
See you next week. Have a great day.